Over 40 million people in the U.S. suffer from knee pain and lack of mobility, and if you're one of them, listen up, because this morning we're learning about an innovative and minimally invasive procedure that can help you.
Dr. Marc Pietropaoli from Victory Sports Medicine and Orthopedics and Skinny Atlas joins us, along with two of his patients, Beth Macfis and retired Judge Gail Mitchell, along with Jeremy Grant from Zimmer. Good morning.
Good morning.
So, Dr. Pietropaoli, when we talk about this newer procedure, it sort of helps what you already have as opposed to replacing them, right?
Exactly.
Okay, so tell us a little bit about it.
Well, I see, as an orthopedic surgeon, I see a lot of knee pain. So we'll talk about knee because that's probably the most common. And most of the knee pain I see is arthritic knee pain. So arthritis is nothing more than the cartilage on the end of the bone starting to wear down. So we have protective cartilage on the end of our bone. When that tread wears down, that's what arthritis is. And traditionally, we've thought that the pain comes from the cartilage, but it turns out the pain actually comes from the bone underneath. The bone has millions of pressure-sensitive nerve fibers in it, and it can actually be the cause of the pain. So this is a real bone right here, and on the surface it's hard, but underneath it looks kind of like coral or spongy bone. That's where our bone marrow is, and that's the area where these, quote, bone marrow lesions that cause the pain occur. So,
well, how do you diagnose that? How do you diagnose arthritis? How do you know, okay, this pain that I'm feeling is arthritis?
Right, that's a great question. So, you know, the history helps, but basically, traditionally, we get x-rays. And the x-rays, they're going to show the bone, but they're also going to show the space between the bone. And if that space is narrowing, that tends to tell us that there's arthritis. It can even be all the way down to bone on bone. So that's traditionally. Now, we have had MRIs for a long time, and we can see these bone marrow lesions on an MRI. So on the MRI, the bone would be black, and we see these white areas right here. So that's called a bone marrow lesion because it's in the area where our bone marrow is. But basically, it's the cause of the pain, and it's basically a stress fracture. If you actually looked at it under the microscope, it's truly a fracture, a stress fracture. And so there's an innovative procedure. Traditionally, the only thing we could really do would be a knee replacement or a partial knee replacement where we're putting metal and plastic in there. Once we put the metal and plastic in there, you're pretty much married to metal plastic for the rest of your life. And they last about 15 or 20 years. They're very good procedures. I do knee replacements as well, but I also see a lot of patients who are maybe younger and don't, you know, they're not ready for a knee replacement yet, or their arthritis isn't as bad, or they don't want to have a knee replacement yet.
So what are you doing then? What exactly is this procedure?
So I'm going to have actually Jeremy, he's our mixologist here. We're going to let him mix up the actual substance that we inject. But basically, bone is made out of calcium and phosphate. So this is calcium and phosphate. So there's actually a calcium phosphate bone substitute that Jeremy's going to be mixing up. So it comes as a powder, and he mixes it up, and it turns almost like into a toothpaste consistency. So you'll see, if we have enough time when he gets it, he'll be able to pull it up into a syringe. And then in the operating room, the patient's asleep. So a knee replacement is an inpatient procedure. The patient has to be in the hospital for a few days. That's starting to change and lessen. But this is a smaller procedure. It's outpatient. You come in that day, you leave the same day. It's just done through some small poke holes versus a knee replacement, which is a larger incision. So in the operating room, the patient's asleep. They don't feel any pain. And yes, we do drill a drill. It's a hollow drill. It's hollow, and it has either 3 holes or 1 hole in it. And we're able to drill into the area where the problem is. So so we're able to drill using a live x-ray into where the problem is, and then we won't actually inject that, but he'll show you what it looks like. But we actually inject it in, and we can see under the live x-ray that it goes in the right spot. So that area where the bone is soft here, we fill it in. And this stuff sets after 10 minutes. It sets, it's as hard as your own bone. So we're basically putting a biologic substance in there, not plate, screws, metal, plastic, anything like that. And your bone will actually grow into that over time. So it reinforces that soft bone, because when this bone gets soft, it tends to collapse, and then that's what leads to the progression of the arthritis.
So we've got 2 patients here, Gail and Beth. You've had this procedure done. So Beth, how did it feel, and how did it feel beforehand, and now how do you feel?
I had it done last August. I couldn't walk, couldn't work out. It was just very painful.
Prior to
having the surgery, I couldn't bend my knees down all the way. After having it, fabulous. My knee is amazing. It's like brand new.
Really?
Yeah. And Dr. Pietropaoli, you started doing these back in 2014, which I believe was right around the time that you had the procedure, Gail.
The first time I had it done, it was my left knee. I had done in 2014.
Oh, okay.
And that was so successful. When my right knee started bothering me, went in and went to doc, and he fixed me up.
How often do you have to do this sort of treatment? So let's say you treat that one area, right? Do you have to go back and do it again?
Hopefully not.
Okay.
We haven't necessarily had to treat the same area twice, but sometimes people can develop it in other areas of their knee, or they can have more than one spot. So we sometimes treat more than one spot, maybe the thigh bone, the shin bone. We can treat ankles, we can treat other joints, but the knee is by far the most common.
I was going to say, how quickly did you recover? I mean, because with the knee replacement, it's going to take forever. You know, much longer, but.
Fully recovered within a couple weeks.
Couple weeks?
Within, well, again,
He started
Victory
healing.
Sports,
You're a judge, so I believe you.
Victory Sports Medicine, the very next, within a day or so, you're into therapy.
Wow.
Okay.
Now, are you all
Yeah.
active in terms of doing things like?
Before I had to give up golf, I had to give up bowling, I had to give up pretty much everything. I golf several times a week now, and I, still bowl and stuff. I can do about anything.
Great. Okay, well listen, Victory Sports Medicine and Orthopedics has their office in Skaneateles at 791 West Genesee Street. You can also give them a call, 685-7544, or visit them online, victorysportsmedicine.com. And you can also learn more by taking part in our Facebook Live happening today right after the show at 11 a.m. on News Channel 9, our Facebook page. And they're also hosting a free seminar Tuesday, July 31st at Dinosaur Barbecue. What a great place to do it. Starting at 6 p.m. You can pre-register by visiting victorysportsmedicine.com/knee repair.